Right now, Proposition 449 looks like it will be a go in favor of those who support it. At the last check, it has 63% of the vote compared to 37% no's. It deals with health care, and a yes vote supports continuing a secondary property tax, which has been in effect since 2004 to provide funds for the Maricopa County Special Health Care District for the next 20 years. So it's about $38 if your home is worth $200,000. One place impacted by the decision, Valleywise Health Medical Center in Phoenix. So this morning we're talking with Valleywise Chief Medical Officer Dr. Michael White about what that funding could mean. Dr. White, thanks for joining us. I was reading that this basically makes up about, I think, 12% of your budget. So how important are these funds for you?
Well, we're very grateful to the citizens within Maricopa County that continue to support the mission that we have here within Valleywise Health. We exist as a public safety net hospital, and being able to have this funding and the support of the citizens of Maricopa County let us be able to continue to operate and have those services that anyone can access regardless of their ability to pay, and be here as a resource for the community. So this tax support continues to help us maintain our operations, help us maintain our facilities, and really be here for people as they are in need throughout the county.
I couldn't really find any organization that was against this. Maybe the individuals that are voting no don't want to pay the tax every year, but you guys mostly have low income and uninsured patients. You have a level 1 trauma center, of course, the burn center that's nationally recognized. So you do a lot at that hospital.
We do. Again, being able to have this and have the resources to be able to maintain the level 1 trauma center. We have the Arizona Burn Center, which is the only nationally verified burn center within the Southwest of the United States. To be able to continue to provide these resources, be a source of trusted health information within the community, and really exemplify our mission to provide exceptional care to patients, no matter their ability, really is why we're here and why we exist. And this type of funding and this funding mechanisms allows us to be able to continue to provide those environments. Additionally, we have our community health centers, within Maricopa County to provide access to healthcare in those communities and provide an opportunity for training of the next generation of healthcare professionals. As you travel throughout the valley, many of our physicians and advanced practice providers, nurses, all have had experiences within Valleywise Health as part of their training, and then be able to go on and serve that greater community. This type of support really helps us be able to maintain that mission.
And you're a teaching hospital as well as all of the rest that you're talking about. Did you see the latest cases today with COVID? 2,135 new cases. I'm curious, are you seeing those kinds of increases at your hospital?
Yes, unfortunately, over the last 2 weeks, we have started to see a slow, steady rise in the number of COVID-19 positive patients that are being admitted to the hospital. Coincides with the number of positive cases that we're seeing within the community. So, yes, we are starting to see that here in the hospital as well.
Has anything changed as far as what you're seeing in terms of the age of patients and how sick one person might get?
No, we're still continuing to see, that same patient population that we were before. Now, the number of positive cases, as we see reported by the Arizona Department of Health Services, is in that, that smaller, younger age demographic. And those folks in that hospitalization range are some of that younger, but again, are going to be in that middle age bracket like we saw in July and August, in that early part of the surge that we saw.
Well, Dr. White, thanks for your time. We appreciate it and all the good work you guys do down there.
Thank you for your continued support.